Education is always a part of educating your consumer base, educating these employer groups, educating their employees. But they don't eat, sleep, and breathe this stuff like we do on a daily basis. So while education is a critical component to change and systemic change, we've created, solutions through specific types of health plans that have done the thinking for them. And the way that we get people to participate in, using your example, riffing off of your example, how am I going to get these employees to the best quality surgeon at the best possible market price that I can absolutely get? Well, instead of asking the patient to be the researcher, you go find out which is the top surgeon at the best price. Man, people got busy lives. They're not going to go out there and do that kind of work, Eric. So our health plans that we're creating here for self-funded employers is we've already done this work for them. And then we build in steerage components within the plan design that say, hey, Eric, when you need to, when you get ready to have that surgery, by the way, we've already identified the top surgeon at the best price. And if you go there, you're going to pay $0 out of pocket. So now we've taken all of this intellectual work that we've asked consumers to do, go out and research, go out and shop, go out and look. People aren't doing that. People aren't going to do that. And so we do that work for them. And education's a big part of it. But that's what I mean by the status quo is so easy. We have to make the alternative just as easy to participate in as the status quo. And when we achieve that, Eric, when we make our solutions and alternatives just as easy for people to engage in, then people will engage in them like they engage in the status quo.
Welcome to the RockstarsRocking podcast, powered by Voluntary Disruption, a show dedicated to people who are crushing their business and life goals. These are bite-sized conversations with leading rock stars in their respective industry who are pumped to share their story to help drive you to the next level. So, are you ready to rock? Speaking of rock stars, here's your host, Eric Silverman.
Hey, rock stars, welcome back to another episode of RockstarsRocking, where you know it. I say it every week. I only have the finest, the top rock stars rocking it out each and every week in their personal and business and daily life. And this week, it's no exception. Everybody help me welcome my good friend from the Amarillo, Texas area, Josh Butler, president of Butler Benefits and Consultant. What's up, Josh?
Not a lot, man. How you doing?
Man, as I said earlier, if I was any better, I would be you. I'm living the dream here, my friend. Thanks for asking. And thanks for coming on the show.
Absolutely. Thanks for having me.
Absolutely. So look, I want to get right to it, man. You're doing some crazy cool things over there in Texas. And but the best part is you're getting recognized, and you're not just getting recognized locally, you're getting recognized nationally, my friend. For those that don't know, Josh Butler, again, president of Butler Benefits and Consulting. This guy I'm talking to, the guy you're listening to, get this. He is a top 5 broker of the year finalist by BenefitsPRO magazine. Our good friend Paul Wilson and his crew added Josh. Can you believe that? They added Josh to the list of the top 5 broker of the year finalists. Man, I'm proud of you. I've known you for years. I couldn't be any more happy for you, my friend.
Well, thanks. I guess the Great Resignation claimed so many brokers that they whittled it down to me. But no, we're in all jokes aside, we're very honored and humbled to be just recognized, like you said, getting recognition for the work that we do and the things that we've been working on here at our firm over the last few years. And it does feel good to get some recognition and hopefully will help, create more momentum for us going forward and what we're trying to achieve as an organization. As I mentioned to you another time before, win or lose, we feel like we've already won to be mentioned among the great finalists this year, and even top 5 finalists and winners from previous years. It's a very elite group of people, and we couldn't be more honored and we couldn't be more excited. Hopefully I win. I don't know. I want to win, but even if I don't, like I said, it's still a win in our book. So yeah, we're appreciative.
There you go. Well, full disclosure, and transparency, of course, anybody listening, you may or may not be listening in advance or just after the actual winner is announced? I don't know. I don't handle that part of the podcast. I let my editing team do that. So if you're listening before what is it, May 23rd, 4th, 5th, something like that. If you're listening before that in 2022, then we don't know who won. If you're listening after, then we do know who won. And we're hoping, of course, that it's my good friend here, Josh Butler. So Josh, let's talk about that, right? Your best of the best, top 5. What do you think? What do you think made that happen? I mean, there were hundreds and hundreds, maybe thousands of people in the running. I mean, there's hundreds of thousands of advisors and brokers and consultants out there. So what do you think made it special for you? What do you think BenefitsPRO and their editorial team saw that really made you stand out among the elite?
Well, without having a crystal ball, I can't read their minds and tell you exactly what it is. I think that the things that make us unique are things that BenefitsPRO is looking for, is that there's a lot of tremendous brokers out there, a lot of tremendous consultants and advisors that maybe they didn't get the recognition. So, why me? I don't know. We're blessed. And I think that we had some people that, because I do understand the broker of the year nomination process. I've nominated people in the past, and they ended up, I've nominated past winners. I've nominated past finalists. And I know that the questioning that goes into making a nomination, I know that BenefitsPRO and their editorial team, they're looking for uniqueness. They're looking for not necessarily how big is the brokerage firm or how large is the book of business or how many clients does the broker have. I think they're looking for uniqueness and people that are doing innovative and creative things that impact people's lives, not just, selling a product or something like that, just that they're doing meaningful work. And we are doing meaningful work here. And I know the other finalists are. I've read their stories. I know a couple of them have a chance to, at BenefitsPRO, I'm speaking on a panel with another finalist. So getting to learn more about her and what she does for her clients, it's really inspiring. It's also humbling because there are so many good consultants, advisors, and brokers out there. But I think that ultimately what led to us becoming a finalist was we are doing some pretty creative work here in the Texas Panhandle and other places, other little pockets around the country that are having a large impact on everyday working people, small businesses, medium-sized businesses, large businesses. So I think it's the meaningful work that we're doing.
So yeah, I mean, look, I like I said earlier, and this, of course, we've known each other for quite a while, and I've gotten to know you more over the years. And you and I think alike. We're both huge believers of challenging and as dare I use my book as the name, breaking through the status quo that is still the national healthcare, and what most companies, small, mid, large, and even mega, are still doing very status quo-esque things when it comes to major medical and all the surrounding benefits. So talk to me about your opinion. I know you're an opinionated guy. I'll give you a chance. Get on that soapbox, man. I want you to get a little fired up and tell us what's wrong. Tell us what's going on, man.
Well, it's interesting because I've just signed a contract this week and I'm about to start a radio program. It's a local radio program here in my community, just because of conversations that I have. My soapbox is, the status quo in healthcare is just, I see it devastating a lot of people, as many people as it's helping. I mean, I want to be real clear, our healthcare system is great in the aspect of, for the most part, I mean, people are treated fairly. They get good quality care. They have good quality surgical procedures, stints in the hospital, whatever. But the financial impact that our healthcare system is having on our economy, and it's trickling down into the individual family level. I mean, it's cliche to say it now, but it still bears saying. The number one cause of bankruptcy in this country is medical debt. I mean, it's linked to a medical event. And so that alone is just, and now we're starting to see inflation in the economy affect people in real ways. They're feeling it at the pump. They're feeling it in the grocery store. They're feeling it as they're trying to send their kids to college. And, we're not like the federal government, Eric. We can't go over here to the closet and just start printing $100 bills. to make things better. And we can't do that. I mean, we all run household budgets. We have to make ends meet. And, I'm very, very frustrated when I have to, when I see clients or I see people having to make daily decisions between insulin and, new tires for the car because they're about to just blow up on you, so these are real life decisions. These are real life situations that we're helping people manage and get through. And so, that's what motivates me is, I'm a problem solver by nature. I've said this to other people. I like puzzles. I like riddles. I love games that require you to think through a complex problem. And I get to do that in my professional life. We get to solve problems and we get to help people. And we're just fortunate enough to be able to have a business model built around that.
So keep going with that, right? So, I'll turn it around. Riddle me this, my friend. Wouldn't you say that that indecision is still a decision, right? How many times do we meet with clients and prospects and people and it's crazy because it's not just insurance, it's anything in daily life where, you present a good idea. A lot of times they even admit and say that's an incredible idea, but yet they don't move forward. They continue going back to their bad habits in the status quo era. So again, an indecision is still a decision. What do you think is stopping employers and human resource departments and the C-suite from taking that leap of faith and trusting? And again, we want it to be you, right? But if it's not you as the advisor, some other advisor in Anywhere USA gives them a great idea. What's stopping a typical employer from moving forward?
There's a lot of things that prevent them and give them reason to pause and to maybe delay their decision-making process. But one thing that it empowers the status quo, in my opinion, almost as strongly or maybe stronger than any other component, is it's easy. I mean, it's easy to go out and continue to do what you've always done and not rock the boat. Also, people are afraid of, making these types of big decisions because what if it doesn't work out? Then, maybe their jobs are in jeopardy or their reputations are in jeopardy.
Sure.
And nobody wants to look foolish. And whether it's healthcare or it's the internet or it's any other type of new innovation that comes out, you always have the early adopters. You always have the majority of people that adopt. Then you always have the laggers, And I think that's what we're seeing right now is we're still in the early adoption phase for a lot of the solutions that are being implemented out there across the country, not just by my firm and what we do here. But like I said, there's a lot of great advisors and consultants out there that are doing tremendous work, and they deserve a lot of credit too. And I think that the momentum is building. I know that it's built for us. It's building for us here in a local market in the Texas Panhandle and the North Texas region and in other little pockets around the United States where we have clients. We see the momentum building out, and it truly is, it's kind of unique to watch it's like a grassroots movement and how much time and patience and work and diligence and just truth be told, loneliness, where a lot of times, you're the only one saying these things in your market, or you're the only one having these conversations. It can get lonely at times, but we see the effects of what the end product of our work. And I think we're helping more people than we're not helping. And we're going to continue to do it. And, but I think just familiarity keeps people entrenched in the status quo more than anything else.
A lot of people think that, the number one hospital for this and the number one provider for that is because they're truly number one. And look, I'm a marketing guy by trade. It's marketing. It's marketing. I'm in the Baltimore, DC area, and I drive on 95 and I see a big billboard that says XYZ hospital is ranked number one for this, that, and whatever. And, says who? A lot of people, doctors are no different, right? How many times do we have clients of ours say, well, we go to the top doctor? Well, why is he the top doctor? Well, he's got an award that says he's a top doctor. Okay. Did you know that you can buy those things and they're all bought? Like, money matters, you got to pay to play. So it's such a big fallacy and misnomer, and I'll ask you this, what do you think about, the education level of the average employer, HR person, let alone the healthcare consumer, who the employee themselves? And what I mean by education level is not college or high school or master's, What I really mean is their ignorance. And I don't mean stupidity. Ignorance is lack of knowledge. Their ignorance where, I see it every day on Facebook. Somebody posts a post and says, hey, who's a good knee surgeon? I gotta have lower back surgery. Who's a good surgeon? And the comments just are mind blowing because it's people saying, well, the Dr. Smith is fantastic over on Butler Avenue. And, they have really good magazines in their waiting room, and the receptionist, she's a doll. Like, I don't get that. How do we stop that? I'm curious your opinion, because you see it too.
Yeah, I think that there's always going to be the necessity for education and the opportunity to educate the public, but it's kind of like wellness programs. If we rely strictly on wellness programs to solve the healthcare cost issue and the healthcare price issue, if we just say, here's going to be our strategy, we're going to wait until everybody in society gets healthy enough that there are no claims. I mean, first of all, that's never going to happen, right? Second of all, even if it did happen, how long would that take to happen, right? So
Right.
that's kind of like the same concept when we talk about education. Education is always a part of educating your consumer base, educating these employer groups, educating their employees. But they don't eat, sleep, and breathe this stuff like we do on a daily basis. So while education is a critical component to change and systemic change, we've created, solutions through specific types of health plans that have done the thinking for them. And the way that we get people to participate in, using your example, riffing off of your example, how am I going to get these employees to the best quality surgeon at the best possible market price that I can absolutely get? Well, instead of asking the patient to be the researcher, you go find out which is the top surgeon at the best price. Man, people got busy lives. They're not going to go out there and do that kind of work, Eric. So our health plans that we're creating here for self-funded employers is we've already done this work for them. And then we build in steerage components within the plan design that say, hey, Eric, when you need to, when you get ready to have that surgery, by the way, we've already identified the top surgeon at the best price. And if you go there, you're going to pay $0 out of pocket. So now we've taken all of this intellectual work that we've asked consumers to do. Go out and research, go out and shop, go out and look. People aren't doing that. People aren't going to do that. And so we do that work for them. And education is a big part of it. But that's what I mean by the status quo is so easy. We have to make the alternative just as easy to participate in as the status quo. And when we achieve that, Eric, when we make our solutions and alternatives just as easy for people to engage in, then people will engage in them like they engage in the status quo.
Yeah, man, you're spot on. That's a good soundbite right there. I tell you what, I like how you talked about bringing it to them, right? Turnkey, making it easy, because you're right. If you're doing that and an advisor is building it and designing it properly, then it should never get to where an employee says, geez, I don't know what to do or where to go. Let me just ask all my friends on Facebook who the best surgeon is, which, yeah, you want to know who the best local flower shop is to order your Mother's Day flowers, go for it. Perfect, right? You want to know where to, their experience. I did it recently. Hey, I need to get a vacuum cleaner. What should I get? What should I not get? All right, fair enough, right? But I don't know, when it comes to medical, it always just drives me nuts when I see it. So I love what you said about doing the work for them. Let me ask you a question I asked our friend Dave Chase, founder of Health Rosetta. Little shameless plug. I don't know the episode, but he's been on the RockstarsRocking podcast, so check it out. But I asked him, I've asked our colleague friends and that we know, like Dave Contorno and many, many, many others. But it's typically a similar answer, but I want to hear your interpretation of the answer. So here we go. You ready?
Sure.
Is healthcare broken? Is our healthcare system broken? And I want to hear how you interpret that.
In many ways, I would say that our healthcare system is broken. It broken under the true definition is it ain't working. So if you look at it from the perspective of the consumer or the true payers of healthcare, yeah, it's easy to say that our healthcare system is broken. It's broken for the people who end up having to pay for it. Now, is it broken for the people that reap the benefits from the system? Absolutely not. It's not broken at all. It is a well-oiled machine. It's 20% of the entire U.S. economy. And, even through a global pandemic, the big players in healthcare have made more money than they've ever made. So to say that it's broken from their perspective, no, I don't think it's broken from their perspective, but broken. I mean, when it's the leading cause of personal bankruptcy in the United States, I mean, even a blind person can see that something's broken. Something is definitely broken. And I know other people's answers that, oh no, this is intentionally, the system was set up this way. And that's true. That may be true, but that still doesn't mean it's still broken. It's a broken system. And I think at the heart of it is greed is driving a lot of it. And that's unfortunate because it's not coming from the actual clinicians. I don't think doctors are greedy. I don't think nurses are greedy by and large. I mean, there's some out there. We hear stories, they do podcasts about them, about people that run oncology clinics and they give chemotherapy to people without, cancer, but so they can just get the insurance money. Yeah, absolutely. But are those the norm? Absolutely not. Those are the outliers. It's the system that is it is reacting and it's operating exactly as it's intended to. We are in a for-profit healthcare system in this country. I don't begrudge any company or any organization. I own a company. I want to maximize profits as well. But you know what? If my company, in order to maximize profits, was bankrupting other people, I don't know. I mean, I can't live with, I wouldn't be able to do that. And so that's what I see, is that there's always room for healthy margin in this industry. When it's a $4.5 trillion industry, that's trillion with a T. Every year, this country spends more money on healthcare than the entire German economy. And they're a top 5 worldwide economy. So if healthcare was its own economy, it'd be one of the largest 5 economies in the world. And so it's what we spend. There's plenty of room for margin without having a system that bankrupts people and forces people to have to choose between, replacing the hot water heater in the house and buying a prescription drug that month. I mean, I just don't, that's the problems that we're trying to solve. So is it broken? It's broken on many levels. And that's what we're working so hard to restore.
I love asking that question to health advisors when I have them on the show, because it's such, I always get a similar answer, and that's fair, but I like to hear the twist that you put onto it from your personal opinion and experience. And, the answer I get, like you said, it's broken to a consumer, but it's a well-oiled machine, to use your quote, when it comes to the people that designed it. It's working exactly the way it was intended to do. So I appreciate you answering, though. Let me go down this road. You do a lot of self-funded cases. You try to stay, I don't know if you do or not entirely, but I certainly know you try your best to stay away from the big boys, the Blue Crosses and so forth of the world. When you're designing self-funded plans, do you ever put together programs that allow the employees of your employer group clients to go abroad to get certain different surgeries and procedures done that are A-rated and done by the top of the top docs, but at a fraction of the cost? Have you ever done that? Is that something you would ever consider? Do you find that to be a good solution to save the claims bucket money? Any ideas there?
I think that that was a rage there for a little while. It would be certainly something that we would consider, because as a consultant to self-funded groups, I feel like what is partially my job is helping them find the lowest net cost for lots of things. Lowest net cost for surgical procedures, for specialty drugs, certain services that they need to acquire. We're looking for alternatives to get to the lowest net cost, but also maintain a very high level of quality. And if that means crossing a border somewhere and getting something internationally, if it made sense economically and the quality was good, absolutely, that would be something that our clients would entertain. I know my clients well enough. I know that they would entertain it. But by and large, we're able to find those solutions, especially for surgical procedures domestically. We don't need to go to Mexico to get dental work done. I know a lot of people in Texas do that, and I understand why they do it. These dentists, are American trained dentists, and they simply go across the border to start practices in northern Mexico because the cost of doing business there is just cheaper than it is in the United States. So, yeah, I mean, there's certain situations I wouldn't be opposed to it. Our plans do accommodate for medical tourism. A lot of times it may not be international, but yeah, we've Amarillo, Texas. Here's a great example. I mean, we're about 4.5 hours away from Oklahoma City. I know that you know Keith Smith, the co-founder and anesthesiologist over at the Surgery Center of Oklahoma. We've sent patients to him. Now, Keith is, and he knows this, he came here to speak at an event that I hosted here in Amarillo. We don't send him as many cases anymore because Amarillo now has an outpatient ambulatory surgery center who is our partners, and they're also our clients, that we do a lot of this stuff right here locally where we're able to impact the cost of outpatient surgical care so dramatically right here. But they're only 4 or 5 years old. Prior to that, we could send people to Lubbock, which is about 100 miles away. We could send people to Oklahoma City, sometimes to Denver, maybe to Dallas, Fort Worth. But absolutely, medical tourism is something that we always consider in our plans if it gets to the lowest net cost. And if it ain't just putting the patient completely out, sending somebody overseas to get a knee replacement done, I can tell you, Eric, it's not comfortable getting in and out of that airplane and sitting in those tight little seats. I'm a pretty small guy, so I mean, I'm not really all that cramped in airplanes, but bigger guys and bigger people, if they were, I mean, it's just, you have to take those things. Those are the human elements. We're not strictly just looking at the price tag. There are human elements to consider in these types of arrangements that they do have a cost to them as well.
Well, everything you just described not only is spot on, but I feel like it's just a tool. You have to know all the tools that you have at your beck and disposal, right? You have a tool belt full of stuff. And as an advisor, it's your job, in my opinion, and I do it too on my side of the industry, to know when and where and what to do with that tool. And any good car mechanic or carpenter knows that there's a bunch of tools they loved using, but they don't use them every day. They might sit in the tool bag for months at a time. And then when they need it, they know it's there and it's trustworthy. So I don't know. I look at it from that perspective. And I think the same, everything we just talked about for going abroad or what have you, or even just going down to Mexico, I feel like it can be said about prescription drugs. I feel like there's a misnomer that, prescriptions have to be US based, come from the US, when the reality, and you tell me, Bet, if I'm wrong, but it's the same drug. It's the same dosage, the same brand. It's not like the drug is only available in the US. Somebody overseas needs it too. And if it's a lot more affordable there, why not get it from there? Have you done that before?
Absolutely. International sourcing of prescriptions is something that we do fairly frequently. And I know that there's a lot of differing opinions when it comes, and I'm not going to get into a legal discussion on what our attorneys, say about international importation. I do know this, people go to Mexico and they go to Canada every single day, and they cross that border with a prescription in their hand, so I know that that's perfectly legal. And so absolutely, it just really comes down to, how are you going to pay for it? How are you going to source it? How's it going to get here? All of those have to be worked out logistically, but your analogy was spot on. I mean, that is a perfect analogy, is that you have to, continue putting tools in your toolbox, and with the knowledge and the understanding that you're not going to get to use every single tool every single day. But when the moment comes, having that tool versus not having that tool, that is an enormous differentiator in our line of business, when we can say, yeah, but when this happens, what are you going to do then? And when we can answer those types of questions, because employers love to play stump the dummy. That's what we always kind of call it behind the curtain, let's see if we can get this guy to say, oh, I don't have a solution for that, or I don't have an answer for that. And it happens from time to time. The way we address it is we're just honest and transparent. Say, I don't know the answer to that question, but I know somebody that does know the answer to that question. And that's where I feel like, the circles that we're in, and we have we're blessed to be able to be in organizations like Q4I with Kevin Trokey. I know you mentioned him to me earlier before, and Health Rosetta is another organization where the collaborative nature of those organizations has really benefited our firm, and so we're very grateful for that too.
Yeah, I love it. You're plugging my past guest, man. Kevin Trokey was also on the RockstarsRocking podcast. Shameless plug. Go look at that episode. Check it out. It's a doozy in the best way possible. I love Kevin and Wendy. I got to get Wendy on the show too. So let me kind of switch gears a little bit, but not exactly. So you spend all this time, all this effort, hours, months, weeks, months, years, educating your employer group clients and prospects to bring in all of these innovative things that you want them to consider and ultimately move toward. Arguably, I would say that these are the most educated people at the company that you're explaining it to, and it might take you 3, 4, 5, 6, 10 times. It might take you years to explain it to an existing client or even a prospect about some feature or some program or tool that you want them to consider implementing. And then one day the light bulb goes off and they get it and they say, oh my gosh, now I understand. Yes, let's do it. I'm ready. Let's move fast and break stuff, right? Let's go. And my challenge that I want to ask you is, how do you disseminate that info to the employee who again, I'm not saying they're uneducated. Don't ever quote me on that, but they're arguably not quite as educated on medical benefits as the people you're talking to. And heck, you just spent 3, 4, 5, 10, 12 times talking to them about the same thing. And yet the employee, they're only going to typically hear it once or twice during open enrollment and then never again for the rest of the year. So how do you get that message down to the end user, the true consumer of healthcare? What's Josh at Butler Benefits Consulting doing?
Yeah, it's a good question. Conceptually, what we're doing with employer groups is not hard to grasp. And, you mentioned Dave Chase. You've had him on your program. I'll tell you one of my favorite quotes from Dave Chase over the years is, these solutions in healthcare, they don't require a tremendous amount of IQ or intelligence. I mean, gosh, Eric, if I can do this stuff, I'm living proof that.
Well, that's for sure. We know that.
Right. It doesn't require enormous amounts of intelligence. What it requires is you got to have courage. You got to have courage just to stand up and say, we're going to do this. You got to have a backbone. And so the years that we spend is not getting people to understand what we're doing. They understand it from the very beginning because our solutions are very commonsensical and they're very, practical. But that's not the problem. The problem is getting over their fear, having the courage to say goodbye to the status quo, saying goodbye to an old broker, saying goodbye to an old way of doing things, maybe saying goodbye to a big insurance company or a big consulting firm. No, that's why we have the saying in our industry, nobody gets fired for hiring Blue Cross Blue Shield, because when things don't go well and your plan's not performing the way you want it to, everybody kind of throws their hands up and says, well, what were we expected to do? We hired the largest insurance company in America, for crying out loud. You can't blame me.
But right. No, you're right.
But when you co-hire a boutique consultant that runs a boutique firm and you go hire an independent TPA instead of a big national carrier, and then things may go wrong, then all of a sudden the CEO is looking down there on the table and he's like, hey, you're the one that convinced us to do this. And then, so you're fired. And so that's the fear people have. And that's the challenge, is getting people over their fear. And I'll sum it up with this analogy. One of my favorite movies is The Dark Knight, the Batman, Dark Knight, when Heath Ledger was in that and he played the Joker. It was a great movie. And it's the scene when Harvey gets burned and he's in the hospital, and I guess the Joker was going to blow up the hospital, and it's when they first reveal Harvey Two-Face, and he's having a conversation with him about, what's crazy about people is if you tell them before something happens, like if I come on the television and say I'm going to blow up a hospital tomorrow, nobody freaks out because they know what's going to happen. And so to me, that is how we get employers over the fear of the unknown. Is you got to give them a roadmap of this is what we're going to do, but this is how we're going to get there strategically. Then people don't freak out as much, and it helps them alleviate that fear and get over that fear of not only are we going to perform better, save a lot of money, and deliver world-class benefits to our employees, but here's a roadmap to get there. It all goes back here to what I was saying earlier. You got to make the solutions and the alternatives just as easy to choose as staying with Anthem. You just have to make it that easy. And when we make it that easy and we lay it out and it's transparent and they see a roadmap to success, then that's what's driving a lot of our success. Is you have to lay it out for them step by step by step, month by month by month. Here's what we're going to do to get you here to get better performance.
So I get it. I totally get it. And I like what you said, what Dave Chase said. He might have said something similar on the show, because I mean, I've heard him say it before too. That's when you're talking to the employer and getting the deal done. But, you know, walk me through how you would explain it to the masses. You have 50 employees or 500. You got people who are used to having that little blue cross on their card, or the, I don't know what the Aetna logo looks like, but you get the point. So how do you get, I'm the employee, I'm arguing with you, what, this is terrible, I don't want this, I don't want to go there, I just want to be able to go to the doctor. How do you get me as an employee to embrace that new solution?
Yeah, and sorry, I know that was your question. I didn't.
That's all right, but I think it's important that we talk about the consumer of healthcare.
It's a much different conversation than we have with the C-suite or the HR departments on the mechanisms and the inner workings of the health plan. That's reserved for the decision makers. When you get down to the member level, you're right, it's a very different conversation. Ultimately, Eric, what I've learned over the years, people don't care. They don't want to know and understand that the idiosyncrasies and the inner workings of a health plan and the risk management strategy that's behind the scenes and all the vendors that we integrate into the plan. They don't care about that stuff. What they care, but I'll tell you what people do care about is that you're saying that if I go over here to get my surgery, I'm going to pay $0, but if I go over here, I'm going to pay $3,000. People understand that. Okay, sure. They understand, and that's what it all comes back to that cliche saying of what's in it for me. So what we say and the way we present it to the end consumer and to the members and to the employees, when we construct this type of health plan, here's what's in it for you. Because I'm going to tell you something, when you go into and you're about to fire a BUCA and you're going to implement one of these COHPs or one of these high performing health plans, people are extremely skeptical. They're saying, why, before you ever even come, they're asking questions like, why are we doing this? And they're skeptical, and they start to make, they start to assume certain things like, well, the company's only doing this because it's going to save the company a bunch of money. And is it going to save the company a bunch of money? Yeah, it very likely is going to save the company a lot of money. But we're also going to save you a lot of money. We're going to build a health plan that when you use it correctly and you use our advocacy service and our cost containment services, we're going to share in the savings by eliminating your out-of-pocket, eliminating your co-insurance, eliminating your deductible. And that message carries. That message resonates. Now you're starting to put value back in their lives, money back in their pockets. And now maybe they're not having to make a decision between the hot water heater and their insulin that month. You see what I'm saying?
Yeah.
And so we just focus on what's in it for them.
Yeah. I mean, you're telling everybody to tune into everybody's favorite radio station, WIIFM. What's in it for me? That's what they care about. And I think you hit it spot on, nail on the head, man. So look, as we wrap up, look, a couple of things. One, I heard a rumor. I don't know if it's accurate or not, that you're starting your own COHP, or better known as a community-owned health plan. Is there any truth to that? Is this breaking news? Is this an exclusive for the Rockstars Rocking podcast? Tell me about that, man.
It's pretty breaking, so I appreciate you bringing it up. Yeah, community-owned health plans. We don't have a ton of time here, so I won't go into the depths of that, but we've launched a product here in the Texas Panhandle that's called High Plains Health Plan, HPHP. And it is for self-funded employers of 25 lives or greater for now. Future plans to try to trickle that down even into smaller companies below 25 employees. But for now, It's a plan that is that's highly customizable. So when a company participates in High Plains Health Plan, they are given the flexibility to choose their own deductibles, choose their own co-insurance levels, things of that nature. And then it's all predicated on community direct agreements with community facilities and providers that we've negotiated. And it's backdropped with a national PPO network. So the question always comes up, well, what if we go somewhere and it's out of the country or out of the state or something? Well, then we have an overlay with a PPO network that we lease for those types of things. But the health plan, we've already got several companies that are participating in a pilot program, and they have for about a year, almost a year, about 10 months now. The data that's coming in is great. I know we only have 10 months worth of data right now, but the participants are experiencing pretty significant cost reductions. And it's just a new way to administer employee benefits. It's not brand new. Like I said, some of our solutions are they're commonsensical, they are practical, but they're embedded within a plan. And we're delivering that in a wrapped up, bundled little plan called High Plains Health Plan for employers of the Texas Panhandle. We're really excited about it. It's going to be great.
That's awesome, man. Well, congrats on that. That sounds like it's going to be awesome. And do you have any idea when it's going to be officially released and you can start putting it together or start putting clients with it?
We're already doing RFPs for companies now. So we already have about 5 employer groups that are participating in High Plains Health Plan. But we have gotten letters of commitment and verbal agreements from many employers that are just waiting until their next stop loss renewal. We don't, unless it's just something very, very unorthodox, we wouldn't advise a self-funded plan to break up or cancel a stop loss contract in the middle of it. So we're just waiting on some timing here for companies to come on. We're going to have it on our website very, very soon. We're working on a different website for High Plains Health Plan where the public will be able to access a lot of information about it. In the future, other brokers will also have access to it as well. So we're excited about that. And so just building solutions right here. Healthcare is local. That's cliche, but it's so true. And we've learned that through this process of building out High Plains Health Plan.
That's fun. That's fantastic. Well, congrats on that. I know that's not an easy task to build that and put that together over the last many months, or who knows, even years. I'm sure it's been on your mind for years at least.
We've been working on it for 3.5 years. So yeah, it's been a while.
There you go. There you go. Well, look, man, you said it all. I appreciate you coming on.
Yeah.
For those that aren't already connected with Josh, I can't imagine if you're listening to this, you're not connected with Josh already, but if not, he's very active on LinkedIn. Check him out. Find him on LinkedIn, Josh Butler, President, Butler Benefits and Consulting. If you have a question or a thought, I'm sure you could reach out to him on a direct message. He has also got a website. What's your website, Josh?
It's butler-benefits.com.
butler-benefits.com. And yeah, guys, this is Josh Butler, one of the top 5 Broker of the Year finalists 2022 in BenefitsPRO magazine. And again, like I said, you're either listening to this right before or right after the announcement of the actual winner. But as Josh said, and I completely agree, best of the best, top 5, you're a winner no matter what. So
right.
Josh, congratulations. I'm rooting for you. I look forward to seeing you in Austin. I'll be right there in the front row taking your picture, and we'll see what happens, my friend. And those that are listening today, if you have any questions or thoughts or ideas for myself or Josh, please don't be shy. Drop them in the comment section below. And look, man, I just show up and have a conversation with old friends and new friends alike, but I don't do any of the back office stuff. So that's a lot of hard work. I don't want to do that. So for everybody behind the scenes at the RockstarsRocking podcast, I'm Eric Silverman. That was and always will be Josh Butler. And thank you, Josh. Thank you, everybody listening. And don't just have a great week, make it a great week. And we'll see you then. Thanks, everybody.
Thanks so much for tuning into this episode of the RockstarsRocking podcast. If you haven't done so already, make sure you're subscribed to the show wherever you consume podcasts. And if you feel so inclined, please leave us a review. 5 stars would totally rock. Until next time, Rockstars, keep rocking.